Dr. Keynes. Thanks for checking out this video. This video is going to describe visually what goes on behind the scenes in robotic prostatectomy. So you may be here because you're considering having the surgery or you have it scheduled and you're wondering what actually goes on. So this is a PowerPoint presentation and I'm going to go through it for you with explanation. So these pictures are courtesy of an app called Draw MD Urology, which is no longer active. It was invented by two incredible urologists, Dr. Kudikoff and Dr. Morgan. I had grabbed these images when the app was still functional, so credit goes to them. Let's start going through them. This is a close-up of the bottom of the bladder and the prostate. So prostate basically has two roles, one of which is it happens to be part of the urinary channel. So a man urinates right through the center of the prostate. This is the prostate right here. The prostate is not two separate things. It actually surrounds the entire urethra channel here, but the artist has sliced the prostate open so that you can see a cross section. So again, bottom of the bladder, prostate, urethra, heading towards the penis, and this is the sphincter muscle. When you're not urinating and your bladder's storing urine, this muscle squeezes the tube shut so that you don't leak urine. This is a side view. So the penis is in the front. This is the anus right here. And the way our body's designed is the back half is the intestines and the front half is the urinary tract. So this is the bladder. This is the urethra channel. You urinate out through the penis. And again, you urinate through the prostate. This purple thing right here is the prostate gland. And this is the rectum back here. If I turn this as if you're lying down, this is just to orient you because the rest of this presentation is going to focus on the anatomy from this view: bladder, prostate, urethra. So now in a little bit more detail. This over here is the bladder. They've drawn the prostate in purple. You can't see the urethra tube because we're looking from the outside. This is the urethra heading towards the penis. This is the sphincter muscle. Again, it wraps around the tube, squeezes it shut so that you can hold your urine. This here is called the seminal vesicle. That's where the body stores semen, which gets us to the other role of the prostate. The prostate is involved in ejaculation. When a man ejaculates, fluid from the semen is expelled into the urethra. It mixes with some added fluid from the prostate, and the ejaculate comes out the urethra. This yellow line right here, if you're researching prostatectomy, you'll probably come across something called nerve sparing. This main cable here, let's call it, is one of two nerves. You'll see the other one in a minute. That's sending a signal from your spinal cord all the way to the penis to create an erection. These branches are sending ejaculation signals. We'll get to that in a minute. And now the rectum is right behind the prostate. If you have had a prostate biopsy already, you know that the majority of the time that's done through the rectum. It's done that way because they are next door neighbors to each other. So this is, obviously in a cartoon way, supposed to represent prostate cancer inside the prostate. Now, what I haven't mentioned yet is this blue line right here. This is a giant vein that lives on top of the urethra and the prostate and that ultimately drapes over the bladder, called the dorsal venous complex. And that vein in prostate surgery is a potential source of bleeding. So that vein gets tied off in the course of prostate removal. There are lymph nodes nearby. What are lymph nodes? You can think of lymph nodes as sort of the recycling plant of the body. There's fluid in all of our organs that needs to make its way back into the bloodstream, and it does that by first stopping at this meshwork of lymph nodes. A better view of lymph nodes is from the front. So let's just pause on this picture for a minute. This is a view from the front with most of the internal organs removed. The intestines have been taken out. The penis is here. This is your pubic bone, and so the prostate can't be seen. It's behind here. Just peeking up here is the top of the bladder. This red thing and this blue thing here are the largest artery and vein in your body. This is the aorta. This is the vena cava. They branch to feed blood to both of your legs and to the organs in the pelvis. Each one of these jelly bean-sized things is a lymph node, and they form the lymphatic system in the body. And there's hundreds in your abdomen and pelvis. In the course of prostatectomy, we remove lymph nodes from a zone here and here. It's similar to breast cancer. In breast cancer, you may or may not have heard that when a woman has a breast cancer removed, the doctor may remove lymph nodes from under the armpit. In prostatectomy, the lymph nodes that are the first likely landing site, if prostate cancer has microscopically spread to the lymph nodes in a representative zone from each side, lymph nodes are removed and then sent to the pathologist to be looked at under the microscope. So what happens during prostatectomy? Now, by the way, this is what happens during prostatectomy, whether it's done open, laparoscopic, or robotic. This red line is the path the surgeon takes during prostatectomy. First, the prostate is separated from the bladder. The seminal vesicle, or the ejaculation fluid pouch, is removed. Then the prostate is separated from the nerve and from the rectum. From here to here is considered the nerve-sparing part of the operation. What that means is saving the main communication of nerves and blood vessels down here, but dividing these little branches that are headed into the prostate. Then the prostate is separated from the urethra and that delicate sphincter muscle, and the whole prostate comes out in one piece. But this picture always takes a little while to sink in because it's pretty dramatic what's happened when the prostate is removed. Now, a couple things to point out. You can see the nerve on the other side. So think of the neurovascular bundles, which is what we call them, as running under the prostate like railroad tracks here. And what's shown in this cartoon is a nerve sparing operation. Sparing the nerves means keeping them intact inside the man's body. The opposite would be sacrificing the nerves, in which case those would be still on the prostate and cut inside the body. We do that when we think that cancer cells are invading into the nerve, and in order to not leave cancer cells behind, in some men on one or both sides, some or all of the nerve might have to be removed with the prostate. What else is going on? Well, there's a hole in the bladder where the prostate was attached. There's a hole in the urethra where the prostate was attached. It's not really possible to save the urethra that was in the prostate because it's not really a separate structure. The urethra is really a hole in the prostate in this area. So when the prostate's out, there's a gap here where the prostate used to be. Normally, the opening in the bladder is not quite that big, but nevertheless, the next step of the surgery is to reconnect the plumbing. I should also point out the dorsal venous complex has been securely tied off here so that there's no bleeding. So the next step, we attach the bladder opening, which is called the bladder neck, to the urethra. This is called the urethral stump. And that looks like this. The way the artist has drawn this, it looks like this is really being stretched. In reality, the bladder is quite flexible and moves to the urethra. These are sewn to each other using dissolvable sutures. The surgical term for this is called the anastomosis. And if we left it like this, with no catheter, there'd be a lot of swelling there. A lot of men would have a tough time urinating. And if they did, before this stitch line has healed, there's a risk of urine leaking out between the stitches. So a catheter is put in. The catheter goes in through the penis all the way into the bladder. It has a balloon on the end, which is larger than this opening. And the balloon is really what holds the catheter in place. Surgeons leave that catheter in for a varying length of time, but typically it's about a week. And then the catheter comes out. Here's another somewhat better view of a catheter. Here's the bladder. There's the catheter. You can see the balloon is what's holding the catheter in. Catheter comes out the penis and is attached to a bag. How's the catheter removed? You see this part here? This is like a little nozzle here that from the outside we can deflate the balloon. And when we do that, the catheter really just slides right out. Now, I'm sure you're interested to know where the incisions are, and this differs slightly from surgeon to surgeon, but when I do robotic prostatectomy, I make 6 little cuts in the belly, and although nobody's belly really looks like this is where the 6 cuts go. These 4 right here are for the robotic instruments. We have a camera, 2 right-hand instruments. You have to imagine the surgeon's viewpoint is looking this way down to the pelvis, so the surgeon's right hand is over here, and we can toggle back and forth between these instruments. There's 1 left-handed instrument, and the way I do the surgery, my assistant is standing here, and so this little cut and this little cut over here are for the assistant to assist with various portions of the operation. This may be cut off by a view of my head here, but in some cases the surgeon will leave a plastic drain to drain fluid from the surgical area. I typically don't do that, or do in less than 1% of the time. Now, what is robotic surgery? What does that really mean? I would think of it more like remote control surgery. The patient's lying here under this sterile drape. I showed you those little cuts we make in the belly. The robotic instruments are installed by the surgeon into those cuts. One of those instruments is a camera. The surgeon works over here at what is basically a cockpit and remotely controls these instruments. You think robotic surgery, it's easy to imagine that, oh, this must be automated. Push a button and the robot does the surgery. That's not the case at all. It's really remote controlled. When the surgeon stops moving their hands, nothing happens. Here's another view, which is pretty close to what things look like in the operating room. Patients lying here under this drape. Those robotic instruments are installed inside those little incisions, and the surgeon's controlling everything at a cockpit over here called the console. One of the nicest things about robotic surgery is that everyone in the room can see what's going on. That means there's a lot of accountability, and it's great for communication because every team member gets the same view that the surgeon does. The only difference being the surgeon gets a 3D view and everyone else gets a 2D view. When the surgeon actually looks into the viewfinder at that cockpit or console, they see a 3D magnified view inside your body and the little robotic instruments that the surgeon controls with these joysticks over here. The big leap from laparoscopic surgery to robotic surgery was that the tips of the instruments now move very much like your wrist. When we're doing robotic radical prostatectomy, the work we're doing is in a space no larger than the size of a bar of soap, tucked away deep in the pelvis under the pubic bone. So the fact that these Gives the surgeon a lot of freedom to do some pretty complicated maneuvers. This is what the robot looks like. In a real surgical case, it would be draped with sterile plastic covers. But you can see there's 4 robotic arms. This one is the camera, 2 instruments on this side, 1 instrument on the other, and it works with a cartridge system. So it's like a Swiss Army knife. Each instrument can be swapped out to be whatever the surgeon calls for. The surgeon might need a scissors in one moment, a grasping instrument in the other, and a needle manipulator in another. And so we need a team of care providers at the bedside to accomplish those tasks of swapping those instruments out at a moment's notice. And this is what the robot looks like from the side. So that's it. That's a little bit about robotic surgery and specifically robotic radical prostatectomy. I hope they answered some of your questions. If you have more questions, feel free to reach out and contact me. I'd be happy to answer them. Have a nice day.